Namaskar, this is Pia, and we have with us a trailblazing activist, a leading urologist, a philanthropist, co-founder of AAPI, who has fought like a lobbyist for the justice of international medical graduates here in USA. And he has recently released a book, Karma and Destiny of an Indian American Surgeon, which details his life, evolution of international doctors and their rights in USA, and advancements as well as cross-country collaborations in medical science. He has presented multiple times to US Congress, met with all Indian Prime Ministers after Mrs. Gandhi onwards. And so let me welcome Dr. Navin Shah on ITV Gold. Namaskar, doctor. How are you today?
Namaskar, namaskar.
So doctor, I honestly, reading your biography, I'm like, wow, what an accomplished life. And I learned a lot from your book. So most of my, family is doctors, and many kids, in fact, they are pursuing medical field as well. And looks like we all owe a lot to your efforts to give us a level of playing field. So let's start by learning about your early life in India and what inspired you to move to this country.
Well, I was studying in Pune, and then I did my medicine MBBS, and later on I did MS. Then I wanted to go to England to do my fellowship, because those days English degrees were very important and fellowship FRCS is very important. But we didn't have money, we were very poor, and I didn't want to ask anybody else, including my rich father-in-law, to give me money. Now, in the meantime, a friend of mine, a classmate of mine, a bright guy, who asked me to join with him to appear for US MLE. That was the American exam for medical graduates. It was free, so I joined with him, and he was very bright. And this multiple choice question, I think, threw him off. So eventually I passed and he failed. And I got a job, I got a ticket, a free travel, and I said, let's try. So that's how I came to America. But I was very scared of failing because I did not know much about America.
Wow. So doctor, tell me, when you landed in this country, and of course, tell me what was the state of foreign medical graduates immigrating here and entering the medical field?
After my training, I started the practice. And for our culture, I had two daughters. I thought it's a good idea to combine all the Indian physicians, which were very small in number those days. And I founded and became later on a president of the Indian Medical Association, mainly to help India and also to keep our culture like Diwali and Republic Day and all those things. Then I joined with the other associations. I called other association leaders. There were about 12 associations. Some are city, some are state, and some are by specialty. So I invited everybody to Washington, D.C. Everybody agreed that we should have an umbrella body called AAPI, and American Association of Indian Physicians of Indian Origin. And that time, everybody agreed with me. And we had an Indian embassy here who had a newspaper, which I think was a monthly. So I put in a big ad that this is my idea and people should call me, and they did. And we found the association. So I founded the American Association of Physicians from Indian Origin to help India and to keep our culture. But later on, when I became president in 85, from 82 to 85, I was vice president. I asked Uncle Kothari to become president because I was very new. And he proposed my name as the vice president. So 85, when I became president, I saw all the problems. There was a discrimination galore. It was open, blatant. And it was in jobs, promotion, hospital privileges, and all facets of medical practice. So I had to do something. And
Right.
this was a new problem for me. And then I went to AMA and they won't help me. So I asked a lobbyist, I hired lobbyists to go to legislative way.
So tell me, so yes, you went there and looks like the, process worked out and the bill, finally, Bill of Equality, it got signed, right?
Right. President Bush, the first president, George H.W. Bush, signed the bill and we got equality. Now, mainly equality because we took that exam, we took that training, we took the boards, all in America, and yet they put us as a second-rate doctors. So that was the fight. And when Ken Bacon of Wall Street Journal put it right, he said, these are the foreign doctors who came and understood the legislative way, utilized the legislative way, and got the victory. I met about 80 congressmen and senators for 5 years. I was lobbying. Every Wednesday, I would close the shop and go and lobby. And in lobbying, I told the Senator Hartke, he was our lobbyist, and Conn Smith, that they should not talk. The talking will be done by me. They can coach me, prepare me, but when we go to the congressman, senator, or their staff, I would do the talking, and that helped me. But it is all serendipity. It's all unplanned. It was in my lap, 38 complaints, so I had to do something.
Absolutely. Doctor, I have here your book, which is called The Karma and the Destiny of an Indian American Surgeon. So I want you to talk about it. What inspired you to write this book?
Well, initially, Amazon Prime in that Trailblazer series interviewed me, mainly for the equality for the foreign doctors. And so I coined the term international medical graduates. Then cancer, prostate, and my projects in India. So they were very impressed. They said, write a book, and I didn't want to write a book. They said, you have to write your past also because America would like to know where you come from. And COVID set in, the business was very slow. So I said, I'll write a book. But I tell you, you should never write a book because it takes almost a year and a half. But I wrote it, and so that's it.
So tell me, you have described in your book, your journey as a migrant, very brave and scary. What made it so?
Well, the thing is, first of all, I was fearful of failure in America. Second thing, I didn't want to come to America because I wanted to go to London. And my father was against me. My father said, all the surgeons are doing well. It is a matter of time. They'll do better. And my father was deadly against my coming. So I was a fear of my father, a fear of failure. And supposing I fail in America, where do I go? I go back to Pune, the same situation I had. That's how I call it a little scary and fearful.
So tell me, is there any particular message that you hope to convey to readers through your book?
Well, the thing is, I think, uh, I think karma or destiny or serendipity all put together made whatever I had done for foreign medical graduates. Of course, I worked very hard. And I was a surgeon, by the way, and I had to start training. But because of my paper published in Archives of Surgery, they waived off the internship. So I was lucky. And I had to do everything all over again, and I did it. So hard work and believe in karma, destiny, serendipity, whatever you want to say. I don't know. I cannot put a label where it happened. It happened unplanned.
So tell me, doctor, what advice would you give to someone, who has recently immigrated from India and wants to pursue medical career?
Well, I think one has to put in the best one I can. I don't look at the clock. I work very hard so that we can do little better than the American graduates. That's number one. Number two, you must involve yourself in research, whether you're in private practice, whether you're an academic, you must, uh, you have your own skills which will propagate and which will move you towards research. And then lastly, you must help India in medical education and healthcare.
So, tell me, like, you have had such a successful journey till now. What is next for Dr. Navin Shah?
Yeah, well, I just came back from India. I want to do physician, US India physician exchange program. But the government is not ready to participate or fund in the infrastructure. The US India Business Council has an office here in Washington, office in New Delhi. I want, say, I'm a urologist here in Washington. I come from Pune. So the Pune urologist and I meet together. It will be done by web. And so whatever he needs, I can help him, my institution can help me, and we can do joint research with US NIH funding. And I would say there is a lot to be done as an immigrant here for India.
So, let's talk about, since you are a urology doctor, you're a specialist. So, let's talk about that. Tell me, what is the difference? Like, when you see, like in India, how, things are treated in urology and how it is treated here. Are things like very different, or it's like somewhat, closer?
Well, what happens in India, they don't get the report. They bring all the names of the medicine, which we don't understand. And second thing, here, we have to dictate everything or write everything or EMR or medical quotation in such a way that the patient can take it anywhere they want. So I think it's very open here. In India, some people bring report of medicine, some people will bring names of medicines, some people will say, I don't know, they did surgery, they don't know. So right now, I think as we see here, India has to improve the medical records and also the surgery records so that when they come here, we should know, because there are 100,000 doctors here of Indian origin.
Right.
So many people come to us, but we have to investigate, and they're not ready to give all the details, or they don't have time, or I don't know what is the problem. But I can tell you one thing. Now, this is a very old story. I went to a major hospital in Mumbai, and I told the doctor, why don't dictate everything? They had a facility. And he said, I don't have the time for that dictation. I treat a patient properly, and my assistant will take care of it, and we give appropriate medicine. We don't have to do all that. So it is very difficult to get Indian doctors to write all the details so that patient, when they travel, they can carry the records.
So tell me, what advice would you give to men, who are concerned about their risk of developing prostate cancer?
Well, in prostate cancer, what happened that 20 years before 2012, when US Preventative Service Task Force declared that prostate cancer screening is not necessary. 20 years before that, we had saved prostate cancer mortality by 50%. And despite of that, they came. So I wrote a letter, I wrote a paper, and I called the American Urology Association president, and he said, we have got a committee, they have agreed with the USPSTF, that is task force. And then I went to the Congress, because my association won't help me. We introduced a bill, Butterfield introduced in the House, and Session introduced in the Senate. And I started writing. I've written about 6 papers and also 12 letters commenting on other studies published. Basically, my advice is, at present, today, all the people above 50 years should get prostate cancer screening. It's only $25 for the PSA test and the rectal examination. Now, look at what has happened to America. Because of the US Task Force Service recommendation, 50% of the general practitioners do not offer any PSA or screening. Now we have more prostate cancer, more patients dying, and more cost to America. America was spending the CMS, this Medicare and medical assistance, was spending $10 billion, $10.5 billion in 2012. Now, 2020, they're spending $20 billion.
Wow.
So more patients died as per Cancer Society, American Cancer Society. More people get prostate cancer and more spending. So I don't know who's helped. I think black people and people with family history of prostate cancer should be started at 50, and other people can start at 55. But yearly screening is very important, very cheap, and at the same time, I would like to say that you have to be aggressive in cancer in the beginning, not at the later stage. So they were talking about overdiagnosis. Now it is different. Now we have parametric MRI to detect the prostate cancer. We have got PSMA, PET CT scan to find the metastasis. So it is easier to treat, and of course there is active surveillance. But we must follow cancer very seriously to save life, to decrease the morbidity and mortality of prostate cancer.
So, Dr. Shah, tell me, like, accepting the screening, is there anything else, men can do to maintain a good prostate health?
Well, unfortunately, we don't have any diet related. Now, they say Mediterranean diet, that is vegetarian diet, as we all do. But I've seen so many Indian getting the prostate cancer, so I do not know. But there is really nothing to do with the diet, at least at present. But family history is very important. If there's a family history and the screening, the PSA and the rectal exam. So those are important things. At present, there is nothing a man can do to prevent a prostate cancer as we know at present.
So lastly, what message would you want to give out to our ITV Gold viewers?
I didn't get your question.
Any message you want to give out to our ITV Gold viewers regarding health or regarding your book, Karma and Destiny?
Well, the thing is, I hope they can read the book. Those people who have read, they have liked it. So, and I will be very happy if the people read and like the book. As far as the prostate cancer is concerned, they should ask the doctor for a yearly checkup with a rectal examination and PSA, which is a blood test, which only costs $25.
So tell me, where can you, get this book?
Amazon has a book, and you can buy. I think it's $19.90. But guess what? In India, it is only $1. It is only less than $5. It's like 250 rupees or something.
Okay.
Because it's printed in India.
Okay. But, I have to say that this is like really a nice book. I didn't get it from Amazon. I got it from you, but I really enjoyed it.
Thank you. Thank you.
And I want to thank you for coming on, and talking to us and letting us know about yourself, about your book and everything else. Thank you so much, and wishing you lots and lots of success. Thank you.
Pia, I wish you the same, very best in life. And don't hesitate to call me if you need anything about the book or prostate cancer. Of course, you're not a candidate for prostate cancer. But if you know, if you have any relatives, I'll be happy to answer any question.
Will do. Thank you so much.
Thank you, Pia.
Thank you.